Hi, this is the presentation for Group 2 on ethics. To start, how would a humanistic leader deal with the COVID-19 crisis? Number one, uniting their citizens. The governor of New York transforming the tone of quarantine into an ethical speech about personal and social responsibility. More specifically, changing the word me to we to give people more of a sense of community, which is one of the most important things in a pandemic. Leadership can help transform selfish motives into pro-social ones. Those who were led by a leader who demonstrated credibility and self-sacrifice were significantly more likely to contribute to the shared investment plan. And through role modeling and genuine conscientiousness, leaders can help the public reframe and perceived costs associated with cooperation in the name of the social good. Next, for government leaders pushing for a vaccine, who gets the first shot when one becomes available? There's been a lot of talk about this recently with the news of vaccines being close to being released to the public. And many have said that healthcare workers are going to be the first to get it. But realistically, it will probably be the wealthier countries that are willing to pay more for a vaccine. At the end of the day, money rules all, and those who have the money to obtain a vaccine will most likely get it first. But immediately after that, governments and countries around the world will disperse the vaccine to healthcare workers and high-risk individuals as well, mainly the people that need it most and the people that is the most urgent to get to. For businesses who are facing falling revenues, will shareholders continue to be their number one focus post-COVID-19? Businesses have already seen the importance of customers, employees, and other non-shareholders during this pandemic. Examples during this pandemic include companies giving extra money to support their families at home, apparel companies creating protective gear such as masks, gloves, and hand sanitizer, other things like that, companies using factory space to manufacture extra equipment, and the development of vaccines. Vaccines are often not too profitable due to high cost of development. Which ethical and legal issues surround access to personal information? There are a plethora of ethical and legal concerns when it comes to privatized data and access to personal information. According to the American Management Association, 45% of employers track content, keystrokes, and time spent at the keyboard. 43% store and review computer files. 12% monitor the blog sphere to see what is written about the company. 10% monitor social network sites. 16% record phone conversations, and 7% of employers utilize video surveillance to track employees on the job performance. It's fair to say that these statistics indicate an unfortunate reality. Companies and corporations around the world have reached full integration into our personal lives as a result of evolving technology. It's hard not to imagine an even more advanced integration of tech into our lives once we've reached a post-COVID, that which will likely demand widely used biophysical monitorization. Will the pandemic make some businesses rethink the fundamental aspect of a corporation? Many questions have come up during this pandemic in regards to business efficiency. A number of businesses have learned that office space may not be necessary and that many employees actually prefer to work from home. Another example has to do with hospital efficiency. Some hospitals were seen as inefficient pre-pandemic due to a high ratio of intensive care beds per population. However, during this pandemic, it was the other hospitals that became inefficient due to lack of beds, despite being considered efficient pre-pandemic. Should there be a nationwide plan and enforcement for the wearing of masks, social distancing, testing, and contact testing? Why or why not? A perfect example of a country that has responded very efficiently to the coronavirus pandemic is Taiwan. They require a mandatory 14-day quarantine when traveling into the country, with daily phone calls from a representative of the local district's office. Taiwan's government has had a strong plan, one that has been in place since the SARS scare of 2003, specifically for managing a pandemic whenever it may come. And more specifically having professionals who have been trained to deal with the pandemic. that are in charge of dealing with the pandemic when it comes. Number 3, easy access to almost free and rapid testing centers in every building. Easy and rapid testing around the country and in every building, including restaurants, gyms, and offices. They check your temperature, and you cannot enter without a mask. We use Taiwan as an example of a country that has a nationwide plan for COVID that enforced wearing masks, social distancing, testing, and contact testing. Because of these efforts, Taiwan has only had 451 cases with only 7 deaths. And life is basically back to normal there due to these efforts made by the government and its citizens. Can you give 2 positive examples and 2 negative examples of good and poor ethical leadership with the COVID-19 crisis? 2 positive showings of ethics would be Mary Barra, the GM CEO who decided to revamp GM's production lines to produce hand sanitizers and respirators, and Dara Khosrowshahi, I hope I didn't butcher that, CEO of Uber, who gave discounted rides to healthcare workers. And negative show ethics, number 1 would be Elon Musk, who decided to keep Tesla factories open during the worst part of the pandemic, and this resulted in a huge outbreak in his factories and his company in general, leaving many workers with COVID. And number 2 is President Donald Trump, who showed poor ethical leadership by disregarding the seriousness of COVID and not wearing a mask in public. These are 2 just very stark examples of how people in power can respond to a crisis like this. And right about now, at this point in the pandemic, we're seeing the repercussions of these choices and decisions that these people have made. What was your key learning from this case? With role modeling and authentic empathy, leaders can restore much of the damage inflicted by the COVID-19 pandemic. Wealthier countries around the world are most likely to access the vaccine first, simply because they will pay more to obtain it. In a post-COVID world, it's very likely that an increased use of technology is a prerequisite for monitoring physical changes within people to detect and prevent infection. And finally, businesses and companies will continue to develop products that are relevant to the prevention of catching and spreading coronavirus. Thank you very much. And here are our sources.